Yes, sir. Mike Dobbins. Here. Dora Petzkowski. Sasha Black Fox Qualls. Here. Danny Callison. Here. Julia Coates. Here. Joe Deere. Kevin Easley. Here. Lisa Hall. Here. Johnny Kidwell. Here. Daryl Legg. Here. Kendra McGady. Here. Cody Poindexter.
Honey.
Joshua Sam. Here. Mike Shambaugh. Here. Melvina Shotpouch. Aye. E.O. Smith. Here. Kendessa Teehee. Aye. We have a quorum.
Thank you, Shelley. On to, approval of minutes. I'd entertain a motion to approve.
So moved. Second.
Motion is second. All those in favor?
Aye.
Any opposed? Motion passes. On to reports. Mr. George Valier from Claremore Service Unit.
Good morning.
Morning.
A couple of things I want to tell you about. We partnered with Rogers County Health Department for a community drive-through flu and COVID vaccine clinic out in front of the hospital. That was really well received by the community. We hired 2 new dental assistants. That still leaves us a vacancy of, we're still 3 short. We're working on that. We've started moving into the new physical therapy space in Annex Number 1. Target date to open that service is going to be December 16th, give or take a few days. We are continuing, physical therapy is continuing service back in the space that they have in the hospital right now, so there's not going to be a lapse of service. Construction is still moving forward on Annex Number 2. That's going to house some of the business office functions, business office finance, coding, and then we're working with the Cherokee Nation to review utilization of space to make sure we're getting all we can out of the space that we do have in the hospital. So I'll take any questions you have.
Questions for George? Yeah, you mentioned the drive-through. Is that for both the flu and COVID?
Yes, sir.
And you're partnering with Rogers County Health Department?
Yes, sir. They came down and donated quite a sizable amount of vaccine, and they sent some nursing down, and we held it right out front there.
So you all got along all right?
Yes.
So is there any, volume-wise, did you attract the numbers you thought you would, or did it exceed expectations? Or? Actually,
it was a little bit lower than we thought it would. We thought it would be, probably because we probably should have got it out, a little earlier, about a month earlier. But we finally got it to fruition and made it happen.
So was that for both beneficiaries and non-bins?
Yes, yeah. Yes. That's when we partner with them, we can do non-bins.
Okay. All right. Anybody else? Questions for George? Danny?
Yeah, George, I've had a couple of calls. To make things right, you guys are still doing things just like every day, even though we're just observing.
Yes, sir.
So business is as usual with the Claremore Indian Hospital. You guys are handling everything and doing everything just like you have beforehand.
Yes.
And the only thing we are is just in an observation type deal.
Yes, sir.
Okay. I mean, I've had calls, people's not understanding, and rumors and everything flying. So just to make sure of that we get out there, and that way you guys are still the ones doing all the stuff. And
no, it's a good partnership because we have new eyes coming in and looking at our processes and working with us. They've discovered some things that we're doing up there that they didn't realize we were doing as best practices. So it's a good collaboration with having them up there.
thank you, sir.
You bet.
Okay, thank you, George.
Thank you.
Up next, Dr. Steve Jones with Cherokee Nation Health Services.
Good morning.
Morning.
We'll just start right in. I guess the report's in your packet. We'll discuss that if you have any questions here in just a minute. A few things I want to go over with my comments. Number one, thank you all that have came and attended our Star Banquet. We had a good time. I think the employees really appreciated it, and Even though you did win the trivia contest, the council table won the trivia, in case you didn't know, and saw the big belt buckle they won. But that was great. We enjoyed having you there. Construction continues to stay on course, on schedule. Of course, we've had great weather, and there's no excuses not to be on schedule right now, so everything continues to progress. In some manners, we're a little ahead of schedule, is what I found out this last week, so that's fantastic. We're excited about all the construction projects. One of the things I want to talk about a little bit is our pharmacy. I know that you have probably gotten calls if you're in the Tahlequah area. We have a situation where a year ago we were notified that our current platform that runs our whole pharmacy was going to be sunsetted. So what that means is at the end, in about 6 more months from now, they're going to discontinue that program, discontinue support, discontinue the program in general. So we went through the process of finding a new company to work with. That took several months, probably 6 or 7 months, to find the right company that fits with how we do business. We decided on that company, and we started to transition and how we were going to transition. One of the difficult things about transitioning one software platform to another is the migration of data. That is the hardest part. And unfortunately, in our situation, we went from RPMS into Cerner, and then from Cerner, they brought us a package. That package is what's going away. It's called Etreby. And we decided to go with McKesson, which is one of the #1 software companies in the nation. So we are in the process, and today is the first day for Stillwell. All of our clinics are going to be slowly migrated over onto this system. Unfortunately, the first migration took place in Tahlequah, and we had to do CNOC and Hastings together because of the way the configuration of the hardware is in that area. We brought in everybody that we could. Consultants brought in their people, and it still resulted in lots of delays, and we are aware of that. We were meeting those as best we could. Our staff has stayed endless hours trying to keep up with the demand, but every single patient has to be migrated over. That historical information has to be migrated over. So, and it has to be validated to make sure it's accurate. And those queues started backing up. And we've apologized to those patients individually that it impacted in a negative way. We do realize there was extended waits. Those wait times have come down. We're monitoring that. Things are coming back to normal. But just know in each one of your areas, there's going to be a clinic and there's going to be a schedule when that clinic comes online. Like I said, today is the first day that Stillwell will be online with that new program. So it's an adjustment. There's a lot of training that goes on beforehand, but there's nothing like the go live dates, and you come across things that you just don't think about. So just be aware of that. We're working on it. We're aware of it. It's going to be a better system when it's all done. We're hoping that it's not only going to, it's going to allow us some additional tools that we've never had on the ways we communicate with patients. We're hoping that we're going to be able to integrate this system in with our patient portal, that at some point in time, you will no longer have the refill center where you have to dial in, that you can do something right on your portal and be able to order your refills. So all these things are working toward the culmination of a better system, but it takes time, and unfortunately it takes there's a little heartburn that goes along with it. So just wanted to report on that and give you a heads up that we do know, and we have heard from some of you, and we've been working with some of you on the patients that were impacted. And if there's other situations that we don't know about, please let us know. We'd be glad to help work through those opportunities also. George mentioned a little bit about Claremore. I wanted to touch base on that a little bit. We do have some staff integrated and officing up there in Claremore right now. We're at that point where we're starting to introduce their leadership at a department level to our leadership and department levels. We're putting eyes on their processes, showing them our processes, looking for opportunities to improve things. So we are at that point where we're still sharing information. We're still requesting information. The Indian Health Service has been good to continue to get that to us as they go through their processes. It takes a little time from the time we request it till the time we get it, but everybody's working toward the same goal, and that's a smooth transition. So a lot of evaluation still going on, but we are making progress, and things have been all positive. I do want to say also that I know there's a resolution today, assuming that resolution passes, and if you have any questions on that, I'll be glad to try to answer those too. Our staff is directed by me to be responsive. We try to be responsive to every question. We try to be responsive to phone calls, whatever that situation is, and try to be transparent. Just know that we are stretched really thin. We have a hospital we're building. We have Salina Clinic that we're building. We have an acquisition of a hospital. And now we have a joint venture possible application that we're going through. So if you don't get a call back directly, give us a little, be patient with us. We're not trying to avoid anyone. Just know that on top of all those things, we have a health system to run, the largest tribal health system in the nation. So just be patient with us. We are trying to do the best we can to get you the answers, but we're not always in the office, and we're not always sitting by an email where we see it. It may be a day or two before we get back with you, but just know that our goal is to get you any answer that you need. With that, I'll answer any questions.
Danny?
Dr. Jones, I know I called in a prescription yesterday and it made me give my birth date. Is that part of that new system, and is that coming to Tahlequah, or are they coming to Salina, or?
It depends. So when there's a migration of data that comes over, sometimes all the data doesn't come. So that's what I'm talking about, validating every single person's chart. And so if there's something missing, or there's a question, or maybe two numbers came over, and maybe it gave, I don't know what the situation, they're going to ask you those questions, and just to verify with the patient. So that's part of that process. It's taking some time, because sometimes you have to have conversations with patients in order to validate the information is correct in the system. It's, we would like to think that it's automatic and 100% accurate every time, but when you're dealing with medicine, we're dealing with medications, we're dealing with people's health histories, we have to be 100% accurate. So there are a lot of conversations, and that slows down the process, unfortunately. We'll get through this, and it'll be a lot better. But and then it's the second thing is sometimes they'll ask a birth date to do a validation that you are who they're talking to, or they may ask you an address. There's several questions that are approved validation questions to make sure the person they're talking to is the person that they're identifying as. Yeah.
Speaker?
Hey, Dr. Jones, just go ahead and give us your spin on the resolution now. Just might as well.
So there's two phases in the beginning of joint venture. The first phase, phase one, has been opened up now, and it was originally supposed to close November 22nd. Now I think, or November 21st, and I think they pushed it back to December 22nd. The first phase is just generally filling out the paperwork that and all the requirements that IHS puts forth. The second, if we are selected through the first phase and we get to the second phase, that's where we go in and start looking at things that are specific to us. Right now, it's just a general application form that we're going. Part of that application form is a resolution from the council saying that they support us going in and putting that application forward. And that's what this resolution is, getting us into the application process. If that application process moves forward and there's other things that come forward, I'm sure between the chief's office and your body, there will be a lot of conversations. But this is the initial phase. You can't go into phase two unless you pass phase one, so this is phase one. And so it's kind of a general approval that we are okay to enter into the application process, and it is specific for the Claremore area.
Okay, thank you, sir. That's pretty good, simple explanation.
Yeah.
Appreciate it.
Thank you. Cody?
Thank you, Chair. I talked to you beforehand about a situation, and I believe it'll get resolved. But could you just reiterate the process of the 90-day prescriptions for just public knowledge, I guess?
Yeah, so the question you asked me was specifically whether a provider had the authority to make that determination. The providers have absolute authority. They have to write the order. A pharmacist doesn't make that decision. A pharmacist has to follow the doctor's order. So it's up to the doctor to decide when a 30-day is appropriate, when a 60-day, when a 90-day is appropriate. We did go in and show our medical staff the tremendous amount of waste that was going on across our system. But at the end of the day, when we were, I'll back up, when we were total 90-day, and with all the new formulary additions and the responsibility that you put on us to be good stewards with our money, we have to be looking at each individual medication and know, is this appropriate for a 30-day, a 60-day, a 90-day? But that determination happens with the doctor or with the provider. And so you gave me a specific situation. I'm going to go back and investigate that situation. But at the end of the day, the provider makes the determination. The pharmacist's duty is to do what the doctor tells them to do. So if we have specific instances that you know of, and you know the provider or the pharmacist or the pharmacy, please get those to me, because those little things like that, I need to go back and check and see where the miscommunication is. I can't do it if I don't know where those are. So I appreciate you bringing that to me.
What else? Sasha?
Thank you, Chair. Thank you for bringing that up, Cody, because I do have a couple of more instances as well, and I can speak about those with you after.
Okay.
But regarding the new pharmacy system, on the migration of data, is there a specific downtime that's involved, and how is that affecting?
It did have some downtime. We tried to do that on Sunday, and then we opened up on Monday with the new system. So we closed out on Saturday night, went to a kind of a flexible system through Sunday. Then we had to catch up with all the things that happened on Sunday while the migration occurred. We're through that phase currently as far as the big migration from server to server. But now we're in this, bringing in each one of the clinics into that system. And so that's what I'm saying. We are past the worst of it. It's just catching up now. And all those people that were caught in that time frame were in a queue, and that queue had to be worked from worst, last of, first in, first out. We didn't want to, someone just came in and we're keep dropping off the person at the bottom. So I'm telling you, those pharmacy staff, they worked hours and hours endlessly to catch that up. And we are a lot better than when we were that week, the week of Halloween. But since then, things our down times have come down a lot. We're going to see those times get even better, because it does take out some of the steps that we were having to do in the old system. So at the end of the day, it's going to be a much, much, much better system. But it's kind of like changing phones. I mean, everybody changes phones. You have this time, a learning curve that you have to go through using your new phone. And it's similar to that, just on a much larger scale.
Okay, and tapping onto that, with the new system, I've had a few reach out to me about their prescriptions being mailed. Will they again have that option? Because currently that's not on that system.
Absolutely, and that's what we have to, so the first migration has to happen with Hastings and with CNOX. That's where your servers are sitting. And then it goes out from there. The central refill center is considered, in our mind, just like a clinic. It has to be brought on. So every one of those individual places where prescriptions happen have to be brought on. And I thought the central refill center migration started last week. I don't have that right off the top of my head. I knew Stillwell started today because we had talked about it on Friday, coming out of the weekend, starting Stillwell today. So, but I can find out for you. But as soon as it's online, then yes, all those opportunities to get your refill sent to home will go straight to your house or to your home, assuming that they meet the qualifications for that. And if you've selected that, then it should be going. I don't know that there's been a disruption with anyone that's currently getting them. It's just signing up for new medications. Maybe there may have been a disruption.
Okay. Also, on a couple of the professional organizations, I know we have Baxter pumps for our IVs. Are we seeing any kind of shortage on the IV fluids? I couldn't recall who our supplier was.
So after the hurricanes hit, there were some factories that were hit. I will say that our supply staff is very good about watching things like that. We were able to go through different avenues. We don't just get our supplies through Indian Health Service avenues. We get them from other directions, and immediately we bulked up our supply, and we never did see really a shortage. We made all of our providers aware that there potentially could be a shortage, to be aware of it, not to change the way you practice, just be aware. And but to this time, I'm not aware that we had a shortage that impacted any patient.
Okay. And are we seeing, last question, I promise. Any extended wait time on establishing care with a primary care provider? Do you know approximately
It
where we're at
depends
with
on
that?
the clinic. Some clinics are in a situation, and I will tell you Stillwell, because that's the one my family uses and I'm most familiar with, their processes on a day-to-day basis. If you requested a provider in Stillwell, you could probably get a provider this week. But you go into another facility, and depending on, and it fluctuates, it ebb and flows week to week, month to month. At certain times of the year, you'll see that wait time come way down. Our goal is to have someone, if you request a primary care provider, to have it established within 30 days. That's our goal. That's faster than any outside office that you can find. So that's and most times we're beating that goal by a lot. But that's the baseline that we've established. So it just depends on the situation, depends on the number of patients that are assigned to each provider. And that helps us determine when we need to hire another provider. We have policies that say a provider can have this many patients if they are a seasoned provider, if they're a nurse practitioner, if they're a PA, whatever their level of training is, we have thresholds that set what their how many patients they can have assigned to them. Once those assignments are full and we see that we're approaching that, that's when we come in our budgets and say, we need another provider at J. We need another provider at Oshaleta. That's how we determine. We're using data to determine that, not just a feeling, well, we might need another provider here. It's something that we can point to and say, here's why we need one here. And that's how we approach our budgets. The other part of that is when you hire a provider, you're not just hiring a provider, you're hiring all the people that go along with a provider. You're hiring nurses, you're hiring support staff, you're hiring registration staff. So we have a staffing model. So when we decide that we need a provider at a certain clinic, we know we have to hire this tree of people to support that provider. And that's how we approach our budgets and how we approach when we come to you and say, or to the chief and say, this is what we need for this next year.
Okay. All right. Thank you, Dr. Jones. Thank you, Chair.
You're welcome.
Thank you for that answer addressing staffing. I think that was real informative. Junior?
Excuse me, I go out to the clinic up here at Tahlequah about 3 to 5 times a month to eat lunch with my daughter who works there. And I'm impressed with the way that you've been able to hold the prices down. That, you know, people can't afford to bring a sack lunch with them because it's cheaper to eat there and the food's pretty good. I just really think that's a good deal, a special needs deal.
Well, I appreciate that.
Will that cafeteria serve the new hospital, or is there a cafeteria going to be in the new hospital?
There's going to be an additional, I guess, a satellite of that cafeteria in the hospital for after hours, grab-and-go type of thing. But that cafeteria, since it will be connected in the building, will serve both facilities. Yeah.
Okay.
And it's not even close to its capacity. I know you only see the front side of it, but the back side of it, there's a tremendous capacity there to increase our operations.
Yeah, I just wondered. All right, thank you.
Yeah. And the goal there is to provide a service. We're not trying to make a dollar. If it just will break even, we're very happy. So we're trying to provide a service. We have dietitians that work with the menus, so we're providing healthy alternatives too.
All right. Thank you, Dr. Jones.
All right, thank you.
Thank you for that information. Lisa, hi, Lisa. It's your turn.
Good afternoon. It's good to see all of you today. Happy to see you. You have our full report it's got quite a bit of information in it. I'm just going to highlight a couple of things, and then if you have questions, I'm happy to address those. We held our very first Diabetes Awareness Month event last Friday here at the complex. A big thank you to Health Services for letting us use their mobile command unit. Our nurses are doing A1C testing, which is your average blood sugar levels for the past 3 months. That supports prevention, decision-making by the patient, early detection. We have 9 more events that are scheduled to be going on throughout the reservation for the rest of this month. Of course, there's also other materials there as well, but this is our first year offering that particular test. The Great American Smokeout is November 21st. We do have events across the reservation, and a reminder that we have a large push on our both virtual and in-person cessation classes, and there's still an incentive for those Cherokee Nation employees who complete the 8-week cessation class. And I want to speak a little bit to summer electronic benefit transfer. We have submitted our intent. It's called the IPOM, Plan of Management, to USDA with our intent to administer the program for 2025. We're already contacting schools, 86 that we've contacted so far, to try to start to get the data sets so that we can start cleaning those and making sure that we get them appropriate. We're building the food package, as you might remember. Tribes have to use a WIC model to administer summer electronic benefit transfer, where states get to use a SNAP model. So what that means is that if we don't want to use the WIC package, we have to actually build a food package that is comparable to a SNAP package, get that approved by USDA, and then work with every vendor across the reservation to make sure they have all of that in the system, all the UPC codes and everything. So we're doing that right now and hoping to get that moving pretty quick. And also working on trying to assess what our redemption rates were for this year. And then one of our goals and one of our performance measures is increasing redemption rates. So figuring out ways to utilize the rest of public health, the community health workers, the public health educators, the dietitians that we have on staff, the other WIC staff, to make sure that people actually go to the stores and spend the dollars, trying to do some outreach with the vendors as well. So those are my highlights. I'm happy to address or answer any questions you might have today.
Questions for Candace?
Well, I'm excited to hear about the summer EBT program and that Cherokee Nation is going to be stepping in for this much-needed program. There's a lot of food insecurity within our districts, and so if we're able to ease that a little bit by acting as that pass-through for that federal money, that's wonderful. I know it adds a lot for your team, but I'm really appreciative of the work that's being done there in public health.
Yeah, it's very important work, and our team is happy to do it. So.
Yeah, absolutely. And there's another issue I want to touch base with you on really quickly after the meeting, if that's okay.
Absolutely, sure.
All right. Thank you for the time, Chair.
Sasha?
Thank you, Chair. Lisa, I just want to take a moment to thank you and your staff. Reading over the report, first, great job on the participation rates for the school health profile. Great job. That's phenomenal. But looking at numbers for Marcoma from a year ago, I don't know if anyone else looked at this stuff, but the total visits from a year ago, you had an increase of nearly 26,000 visits.
Mm-hmm.
The group fitness, you increased 6,000. For Child Watch, you increased nearly 5,000. Phenomenal job to you and your staff. Great work.
Thank you. That's owe that to the staff at Marcoma, a wonderful team there, working really hard to serve the citizens and the community members. So I'll pass that on to them.
Yes, thank you. But also, Kendall and Dylan, they were over the Hulbert Walking Group, and the community members, they absolutely adore them. We had great participation, and they're already talking about the next go-around. So planting that seed there.
All right. Yeah,
it was great. And whoever designed this next 5K, the Frigid Forest, that's amazing. It might be my favorite so far.
All right, I'll be happy to pass that on. Thank you so much.
Thank you
for that.
Cody?
Mine's just a quick comment. I really enjoyed that little event y'all did in front of the complex the other day where y'all checked everybody's sugar and pressure and everything. My blood pressure was high, and I was disappointed, but I guess it comes with the territory. But no, I thought that was a pretty cool deal. Do y'all plan on taking that little event maybe into other communities and doing something like that?
Yes, we have 9 more events across the reservation during the month. And again, this wouldn't be possible without the generous partnership from Health Services letting us use the mobile command unit. We really appreciate that.
Lisa?
I just want to say thank you for attending the Welling Bridge Trails Check presentation. It's absolutely beautiful at the trails. And hopefully maybe that might be a new place that we could add to a 5K. in the
You know,
future.
we've been contemplating that
Yes.
and thinking about how we might do. We probably need to figure out if we want to have a trail run and advertise it
Right.
that way. I think there's only concern's been the width of the
The width
trail
of
and being able to have everybody rushing out, making sure there are no injuries. But I think there are several mitigation measures we can put in place and have something out there. And I really, you have to hand it to the Tahlequah Trails.
Yes.
They have worked tirelessly. It's so beautiful out there, and they're not stopping. They have plans to continue and enhance that, add more miles. I think it's going to be 10 miles when they finish. So.
Yes, thank you.
Any others? All right, thank you, Lisa.
Thank you.
Okay, I don't see none pending old business. Under new business, we've already had Dr. Jones elaborate on it, but we need to formally read this. Dora, would you mind reading that resolution?
This is a resolution approving and authorizing the submittal of a request to the Indian Health Services to participate in the 2024 IHS Joint Venture Construction Program Agreement for construction and operation of the Claremore Healthcare Facility, and I put that in the form of a motion.
Any discussion? Julia?
Like to be added as a
Okay.
sponsor.
I'd like
Shelley, Julia, want to be added as a sponsor?
Me too.
Okay, probably about everybody. Okay. All right, any other discussion? All those in favor of this resolution say aye.
Aye.
Any opposed? The resolution/motion passes. Okay, on to announcements. The next meeting is tentatively scheduled for Monday, December 16th at 1 o'clock. And I have one other announcement. We're having lunch at the Sequoia High School Gymnasium, correct? Okay. 11:45, yeah. Yeah. All right. So, need one more motion. All opposed? Or all those in favor? Okay.
Aye.
Motion passes.